Hello and welcome to this special episode that is being on-aired on TTV on this glorious occasion of the 50th National Day in the Sultanate. Joining us today is a very special guest and of course one of my favorite personalities in the country. Let's welcome His Excellency Dr. Ahmed bin Mohammed Al Saidi, who's the Minister of Health. Thank you so much, Your Excellency, for joining us today. Wishing you a very happy 50th National Day and what tremendous work rendered by the health sector for the people in the country.
Thank you very much, and I'm delighted to be with you. It's a great day for all of us in Oman. It's 50 years since the Renaissance. And looking back, what's been achieved over the last 50 years in all aspects of our life in Oman is tremendous. And the work, of course, will continue, the era of His Majesty Sultan Haytham bin Tariq Sultan Oman, Hafidhahullah.
We understand that we're still in the middle of the coronavirus pandemic that is taken over across the globe. And you know the 50th National Day celebration is right in the middle. I know that a lot of things has been put on hold, but the spirits are really high of the people in the country.
It's true that coronavirus hijacked lots of our freedom, honestly, and it's not in Oman, worldwide, and it's a shame that the plan for the 50th anniversary or the 50th National Day has been tailored according to this pandemic. And this is a message from His Majesty Sultan Haytham to everybody that people's health and life is superior to everything else. This is one of probably the most important day in our history, and yet, and because of this pandemic, the celebration will be symbolic, the celebration will be mainly virtual, and the reason for that gathering is one of the basically high risk to spread this virus.
Your Excellency, I remember interviewing in 2018 and you shared this beautiful story with me that in 1971 there was just one hospital, and until today you told me that it's over 80 hospitals in the Sultanate. Could you shed some light on the journey of the health sector in the country?
To be very frank and transparent, healthcare in Oman before 1970 was very primitive. If not all, most of the health care was provided by missionary hospitals, and we are all very grateful to the work they did, the services they provided at that time, which was very difficult time. I'll give you numbers which are very important. In 1970, in the early 1970s, when His Majesty late Sultan Qaboos rahimahullah became the Sultan of Oman, the life expectancy for Omanis was 50 years for women and 49 years for men only. That's very low by any standard. Today, life expectancy jumped from 50 to 77.7. At that also in the early 70s, from each 1,000 child born, 25% of them, 20 to 25% of them used to die before their 5th birthday. That's also a huge number. Today, instead of 180 child dying before their 5th birthday per 1,000, that number has dropped to less than 10. You've mentioned the number of hospitals. Today we have in the country 83 hospitals. 50 of these hospitals belong to the Ministry of Health, other hospitals for other government agencies and the private sector. There are hundreds of clinics, thousands of pharmacies. 1970, we had 13 doctors only serving the whole country. Today, we have more than 9,600 doctors, more than 1,400 dentists, more than 20,000 nurses. There are 57,000 working in healthcare sector in Oman. Everything has changed completely to the better. This would not have happened without the support from His Majesty's government. This would not have happened without the dedication and hard work of everybody in the country, and in particular the staff in healthcare, who I always give them my sincere thanks and gratitude. So the improvement is tremendous, and this is not what we say only in Oman. This has been acknowledged by international organizations such as the World Health Organization and other agencies. The secret of success in healthcare in Oman, there are many, but one of them, the concentration was on primary healthcare, which is affordable, accessible to everybody, and manages most of the cases. Of course, the specialized care has to also match that and improve, and I'm very proud of what's been achieved so far, and I can assure everybody that Sultan Haytham support for health continuing in a very big way, and it's very obvious, and all of us in healthcare will continue to work very hard, doing our best to look after you, but you need to help us to look after yourself as well.
And talking about, the achievements you just mentioned, Your Excellency, you rightly said that the health sector has been praised by the international organizations across the globe, especially containing the pandemic in the country.
It's a great feeling, but again, this is not the work of one minister or one person. This is a continuation of what started in 1970. This is also achieved with help and collaboration with international agencies such as WHO and UNICEF, and we are very grateful to their input. And we are very proud that when you look at the world's map in health, Oman actually in the front, even though what we spend on healthcare in Oman is very much less than what's spent in countries which are at the same income level. I will give just absolute numbers. We spend in Oman as a country about $1,500 per person per year. The European countries in general, the average is about $4,000 per person per year. Yet, our health indicators are matching in almost all aspects what's happening in these countries. This pandemic has shown everybody how solid and strong our healthcare system. We've been ongoing for the last 10 months non-stop, and as yet, and I hope it will never happen, we have not deprived any person from an intensive care bed. We have not deprived any person from the care that they deserve and need during this pandemic. And the reason for all these success, as I said, are the dedications, hard work, and efforts by all the staff in healthcare. And as I said, Oman is in the international map of healthcare. A good example is our presence in international organization. In 2016, Oman, represented by the Minister of Health, was the chairman of the WHO Assembly. That's 194 countries. This year, Oman is in the executive board of WHO, and also Oman, the Minister of Health of Oman, is the first vice chairman of the executive board, which is the most important body of the WHO. So all these, of course, would not have happened without what has been achieved over the years. And as I repeat, it did not come easy. It came with lots of efforts. And when healthcare started in Oman, when education started in Oman, everything was primitive. The roads were very difficult. The level of education was very low. People's nutrition and lifestyle were not very healthy. And that's why the life expectancy was very low, 50 years. It's not just because of the lack of hospitals, but life in general was very difficult before 1970. And I think we have to appreciate that what's been achieved again was not easy. Therefore, maintaining it and improving on it is even more difficult. It can be easy to reach the top, but staying there, unfortunately, can be very difficult unless we continue doing the work we are doing now, unless we work together, cooperate with each other in health.
Thank you so much, Your Excellency, once again for taking out time and sharing such beautiful journey of the health sector and, of course, the tremendous work rendered by the health employees in the country. Thank you so much. Wishing you once again a very happy 50th National Day.
Thank you very much, and happy National Day for all of us. Thank you.